In this video, we'll do an exam review on the inflammatory bowel diseases. They include Crohn's disease and ulcerative colitis. We'll discuss some of the points which can be discussed together for ulcerative colitis and the Crohn's disease, and then we'll have separate videos on ulcerative colitis and Crohn's disease. Now, etiology and pathogenesis of the ulcerative colitis and Crohn's disease. Normally, oral tolerance prevents inflammatory response against the dietary antigens by producing inhibitory interleukin 10 and growth factor. So the oral tolerance prevents inflammatory response to dietary antigens by producing certain cytokines, interleukin 10 and a growth factor. In both disorders, CD4 cells in the lamina propria of the intestine secrete inflammatory cytokines, TNF-gamma and different types of interleukins which activate monocytes and macrophages and attract other lymphocytes and induce inflammation. So normally oral tolerance prevents any reaction to dietary antigens by producing inhibitory interleukins, interleukin 10 and the growth factors. And in inflammatory bowel diseases, the inflammatory response is due to immune dysfunction. CD4 cells in the lamina propria secrete inflammatory cytokines, TNF-gamma and different types of interleukins which attract the inflammatory substances. So there are many exogenous factors for this inflammatory immune response. They include abnormal immune response of intestinal epithelial to the microorganism. This includes Salmonella, Shigella, Clostridium difficile and Campylobacter. These organisms trigger an inflammatory response that intestinal cells are unable to control. Number 2, anaerobic organisms, bacteroids and Clostridia and aerobic E. coli also induce inflammation. Number 3, substances that alter the intestinal flora. They include metronidazole, Ciprofloxacin, the antibiotic, and also the elemental diet. And number 4, probiotics and lactobacilli inhibit this inflammation. So to sum up, oral tolerance to dietary antigens is altered, and the CD4 cells in the intestinal cells produce cytokines. And there is an abnormal immune response of the intestinal cells to different types of organisms, which include Salmonella, Shigella, Clostridium difficile, bacteroids, Clostridia, and certain other substances like antibiotics, metronidazole and ciprofloxacin and elemental diets. Number 3, psychological factors also influence production of inflammatory bowel disease. Increase in inflammatory bowel symptoms occurs in illnesses, in death in the family, divorce or separation. Number 4, environmental factor. Example is smoke. Smoking has important effects on Crohn's disease and ulcerative colitis. Smoking increases the chances of Crohn's disease by twofold, whereas smoking decreases the ulcerative colitis chances by 40%. So, smoking decreases the risk of ulcerative colitis and increases the risk of Crohn's disease, and quitting smoking increases the features of ulcerative colitis. There are two peak onsets of these diseases. First, between 15 to 30 years of age, and second, between 60 to 70 years of age. These conditions are more common in Jews, especially Ashkenazi Jews. They are more in urban than rural population, more in rich than poor. As I already explained, Crohn's disease chances are twofold more in smokers and 40% in smokers for ulcerative colitis. And smoking decreases the risk of ulcerative colitis. Appendicectomy also decreases the risk of ulcerative colitis, but it increases the chances of Crohn's disease. So both smoking and appendicectomy decreases the risk of ulcerative colitis and increase the risk of Crohn's disease. Now, familial predisposition for these disorders. If both parents are affected, then there is 36% chance to acquire the disease and 10% in the first degree relatives. What about monozygotic twins? In monozygotic twins, the concordance rate for Crohn's disease is 60% and for ulcerative colitis it's 6%. So the concordance rate for monozygotic twin is 60% for Crohn's disease and 6% for ulcerative colitis, and in dizygotic twins the concordance rate for the Crohn's disease is 4% and ulcerative colitis is 0%. So if both parents suffer, 36% chance to acquire the disease. First degree relatives have 10% chance to acquire the disorder. Monozygotic dizygotic twin, Crohn's disease chances are 60% and that of ulcerative colitis is 6%, whereas in dizygotic twin, 4% for Crohn's disease and 0% for ulcerative colitis. Both these diseases may be associated with Turner syndrome, hypogammaglobulinemia, IgA deficiency, and hereditary angioedema. So what conditions decrease the risk of ulcerative colitis? As I already explained, smoking decreases the risk of ulcerative colitis, and quitting smoking increases it, and number 2, appendicectomy also decreases the risk of cancer.